Part of a comprehensive stabilization program for a patient with discogenic instability in their lumbar spine is also teaching the patient the right way to train their trunk flexor or abdominal musculature. So in this video clip, we'll go over a number of different ways, and there are certainly many others. We'll go over a number of different ways to do just that. Step number one is our patients need to be taught how to safely get on one of these Swiss balls. So I like to have the patient move from a stable chair and make sure that the patient understands that they're going to sit on the front part of the ball. Okay. So they just transition safely onto the front of the ball. They compress the ball, and the ball actually becomes quite stable at this point. The next step is we teach the patient how to walk down the therapeutic Swiss ball. And that looks something like this. They can have their hands on the ground. They can have their hands on a chair if they like. A nice wide base of support. So the patient feels comfortable, so they feel as though they're not going to tip to the left or right. Okay? At this point, we're going to start with upper abdominal training and a patient who's very deconditioned. The patient has to flex their hips and get their trunk in front of the horizontal, as you see here. Now, I like this cross-arm position here, and I teach the patient to pull their breastbone down 2 inches toward their belly button. And if you note my lumbopelvic area right now, it's still relatively unloaded and it's not moving. So it's safe. From this position, we can have the patient, once they've developed strength and neuromuscular control, move a bit back more toward the horizontal position. They can maintain this same hand position, or if you and they feel as though their neck needs some support, one hand can be placed in the back of the head to support the neck. Now notice where my right hand is. Notice that it's on my breastbone. We're telling the patient to feel their breastbone move down toward their belly button by an inch or two. And then if you notice my lumbopelvic region, you'll note that it's still stable, it's not moving, and it's unloaded because it's in a horizontal position. So there's 2 ideas for strengthening the upper portion of the abdomen. Now I'm going to continue to stay in this horizontal position where my lumbar segments are unloading. I'm now going to bring both hands up here to support my head and neck and really tell the patient to feel the weight of their head on their hands so that their neck is completely relaxed. And now we begin the process of lower abdominal strengthening with pelvic tilting. So we teach the patient to squeeze their glutes together and pull their lower tummy up toward their belly button. And we start a short arc pelvic tilt. And I'd like you to note that as I squeeze and pull up, I only let my pelvis return to a neutral position. Now my full extent of lumbopelvic motion is here. I could hyperextend and move into an anterior pelvic tilt that far, but that oftentimes is not well tolerated and not very sensible if you're dealing with discogenic instability. So we have the patient squeeze and pull up, relax and let their pelvis come down a little. So this is short arc, isotonic training. Lumbar segments are unloaded and moving very little. That's the key point. Next, in your more advanced patient, I'm going to combine the posterior pelvic tilt along with a mini crunch, and I'm going to bring my upper abdomen down to my belly button and my lower abdomen up to my belly button. So the tilt crunch combination looks a little bit like this. This is a great training exercise for all aspects of the abdomen. And again, note, lumbar spine is unloaded because we're in a horizontal position, and I'm not letting my lumbar segments move very much at all.